Today, we will discuss ear injury. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. An ear injury refers to any damage or trauma to the ear, which can affect the outer ear, middle ear, or inner ear. This can happen due to various reasons, such as loud noises, physical impact, infections, or changes in pressure, like during a flight. Signs you might have an ear injury. 1. Pain, experiencing pain in or around the ear. 2. Hearing loss, difficulty hearing or a feeling of fullness in the ear. 3. Ringing, hearing a ringing or buzzing sound, tinnitus. 4. Discharge, fluid or blood coming from the ear. 5. Dizziness, feeling unbalanced or dizzy, which may indicate inner ear issues. 6. Swelling or redness, noticeable swelling or redness around the ear. What to do? If you notice any of these symptoms, especially after an injury or loud noise exposure, it's a good idea to see a healthcare professional for an evaluation. If someone has an ear injury, here's what to do in simple steps. 1. Stay calm. Keep the person calm and still. 2. Avoid touching. Don't poke or touch the ear. 3. Keep head elevated. Have them sit or lie down with their head raised. 4. Avoid loud noises. Keep them away from loud sounds. 5. Use a cold compress. Apply a cold cloth to the outside of the ear to reduce swelling. 6. Don't put anything in the ear. No cotton swabs or drops unless a doctor says so. 7. Seek medical help. Take them to a doctor or clinic for a proper checkup. These steps can help manage the situation until professional help is available. In the hospital, here's what doctors typically do for someone with an ear injury. 1. Check symptoms. They ask questions and examine the ear to see what's wrong. 2. Pain relief. They may give medicine to help with pain. 3. Cleaning. If there's any fluid or blood, they clean the ear carefully. 4. Tests. They might do hearing tests or imaging, like an X-ray, to see how serious the injury is. 5. Treat infection. If there's an infection, they can prescribe antibiotics. 6. Surgery if needed. In some cases, they may need to do a small surgery to fix damage. 7. Follow-up care. They provide instructions for recovery and set up follow-up visits. The goal is to relieve pain, prevent further damage, and help the person heal. Here are some common types of medications that may be used for ear injuries. 1. Pain relievers. Ibuprofen. Acetaminophen, Tylenol. 2. Antibiotics if there's an infection. Amoxicillin. Ciprofloxacin. Ear drops. Ciprofloxacin, dexamethasone, Ciprodex for infections and inflammation. Hydrocortisone ear drops for inflammation. 4. Decongestants if related to pressure changes. Pseudoephedrine, Sudafed. Always consult a healthcare professional for the right medication and dosage based on specific conditions and individual needs. People who are at a higher risk of getting an ear injury include 1. Kids. They often play rough and can easily get hurt. 2. Swimmers. Water can lead to infections or injuries in the ear. 3. People with allergies. Allergies can cause ear problems, making injuries more likely. 4. Frequent flyers. Changes in air pressure can hurt the ears during flights. 5. Musicians. Exposure to loud music can damage hearing and lead to injuries. 6. Athletes. Contact sports can result in physical trauma to the ear. Being aware of these factors can help people take precautions to protect their ears. Now you need to watch my video on strokes or have a look at seizures.